हेलो एवरीवन, माई सेल्फ डॉक्टर डुमेश मगेंद्र। और आज मैं आपको साइबेरियन स्टेट मेडिकल यूनिवर्सिटी के ऑफिशियल से मिलाने वाला हूं। और इस वीडियो में आपका स्वागत करता हूं क्योंकि बहुत सारे बच्चे जो कि इंडिया से हैं और आगे चल के अपना फ्यूचर एज अ MBBS डॉक्टर देखना चाहते हैं। काफ़ी बच्चों को डाउट्स है रिगार्डिंग द यूनिवर्सिटी, रिगार्डिंग द MBBS इन रशिया। सो आज हम इस वीडियो में हर चीज़ों पे बात करेंगे। और आज मेरे साथ डॉक्टर अनस्तासिया हैं एंड डॉक्टर अमित हैं। हमने पहले भी एक वीडियो बनाया था रिगार्डिंग द NMC रूल्स एंड रेगुलेशन। हमने बहुत सारी चीज़ें उस पर डिस्कशन किया था और काफ़ी अच्छा रिस्पांस था आपकी तरफ से। तो आज हम फिर से एक पर्टिकुलर यूनिवर्सिटी के बारे में बात करेंगे जो कि 135 ईयर्स ओल्ड मेडिकल यूनिवर्सिटी और काफ़ी ही पॉपुलर यूनिवर्सिटी है अमंग द इंडियन सिटीजन्स ऑल्सो, क्योंकि 2015 से वहाँ पर बच्चे जा रहे हैं और काफ़ी अच्छा वहाँ का रिजल्ट है। तो वी विल कंटिन्यू अवर डिस्कशन फर्दर with welcome to Dr. Anastasia, and she will tell us about the university curriculum and all about the university, how they are going to teach our Indian student, and how Siberian State Medical University education system will be helpful for the students who are going from India, and when they will return back to India, and when they are going to give the license examination, how it will be very helpful for them to clear the examination. So welcome, Dr. Anastasia, and I have first question for you, that about the university, how the curriculum is. You have the curriculum regarding the Indian student and regarding the international student, please.
So, hello everyone, my name is Professor Anastasia. I'm a professor of Human Anatomy Department. So, about curriculum at our university. We have 6 years of education in English medium, and this period includes 2 big blocks. First 3 years, it's about basic subjects. It's anatomy, physiology, pharmacology and others. So it's possibility to know how our body work, how our body construct at normal situation. When our students know normal conditions, they can talk about pathology, and that's why last 3 years it's about clinic discipline as ophthalmology, neurology, surgery, oncology, and many other subjects. So, why Siberian State Medical University can give to our students big knowledges and our experience for future working. So, our teachers, our professors, they work with real patients every day at our own clinic, because our university has own clinic. Plus, somebody work in private clinic, and every day our students visit real patients and work with them.
Okay, thank you so much, Dr. Anastasia. Actually, I have one more question, because so many students from India, they have one doubt, because actually in from India, the students who are after NEET, they are having so many options. Except Russia, we have like Kyrgyzstan, Kazakhstan. Actually, I don't suggest any students to go in that small countries, because of their economy and their education system. But they have so many doubts. They think like how the small countries are working. We have the same working culture in our Russian Federation also. So can you please tell me about the anatomy department, how the anatomy department used to provide cadavers and the museum facilities? Can you please elaborate about this situation?
So we have cadavers during education process. As my colleague and you said before, our university has very big history, and anatomy museum start to collect these organs and cadavers from the foundation. That's why the basement of museum is very big. There are a lot of preparation as a pathology, as a normal condition. We have plastinates, it's new technology of preparation dead body from German, when dead body looks like alive. It's very expensive preparation, but our university has possibility to buy it. Plus, we have of table. This is 3D atlas as a table, is anatomy table, when it's possible to build 3D model of our body. That's why every day our students, first year, second year, work with real organs of real body. If you're talking about pathology anatomy, the same situation. At the third year course, they work with real organs, but in pathology condition. If you're talking about crime medicine, the same situation. They work with organs that was destroyed by some crime situation, and that's why the responsibility to see it.
Okay. Dr. Amit, do you have any question regarding the students and all?
As we know, there are lots of Indian students are currently studying there. So, how's your experience like Indian student? Are they practicing very well, or anything you want to say about in future students who are planning to study MBBS in Russia, and especially for Siberian State Medical University? If you want to give any message to our audience people.
So actually I work as anatomy professor last 5 years, and Indian students were my first student. My first lecture was with Indian student, and actually they are as children for me, and I do love to work with them because they are very smart, and they understand their main goal in future, that they want to be doctors, and that's why it's very a pleasure for me to work with them. And what message I want to say, that dear future students, dear future doctors, remember that medical professional is a mission, and you will help to real people, and you will give them hope and care, and it's very important from first years of education understand it, that life of other people depend on you, and you influence to their life.
As we know, we Nastya, Indian students have very lots of option for MBBS in Russia. There are many universities are available for MBBS in abroad. So why they have choose to Siberian State Medical University especially for Indian students? What are the key point factors, and what are the good reason for choose to Siberian State Medical University?
So first of all, if you're talking not about only Indian students, for all students from different countries and Russia especially, Siberian State Medical University is the third medical university at the Russia in the rank. And if you're talking about uncapital university, the first one, it's not simple words, it's the real fact, because we have very big scientific school, we have very big history of working with students, working with patients, and our professionals, professors are good quality and high quality professionals. They work as a real doctors, they write scientific articles in international journals, and they can give their experience and knowledge to our students, and especially about Indian students, foreign students, when our professors make studying plan, they remember about speciality according the region of student. For example, if you're talking about India, when our student, Indian student, have infection diseases, the most point of view will be about actual diseases, malaria, yellow influence, and others. It's not only infection disease, but about other conditions. That's why we remember that according to the region, there is different points of view of medicine that we must know.
Okay, Dr. Anastasia, actually, you had told so many things about Siberian State Medical University, but at the point of view, you have told about the Pirogov table. Actually, the Pirogov table is going to launch in from this year. That will be used in India also. First, our Indian government is launching in AIMS Delhi. So it is good that our student will get exposure before, getting exposure from Siberian State Medical University way before the Indian medical universities. So I have one more question regarding the as you told about the infectious disease and everything, because so many students and parents have doubt regarding the infectious disease, like we can study or not. As you told, there is a department regarding this, so the student will be able to study about the malaria, typhoid, dengue and everything. So it is very easy for Indian students to like get the knowledge of this also,
Yes,
right?
of course, of course.
And what about the facilities regarding the hospitals and all
Uh,
for the clinical practice?
Yes, of course. We have a lot of clinical practice. How I said before, during clinic discipline, every day our students visit real patient and they write history of disease with real patient. For example, I am a student. I am coming to one patient every day, describe his condition.
Okay.
Yes,
So
take
it will
analysis.
be real patient, not
Yes,
that
of course, of
us
course,
not
of course,
just
of course.
we need to write
Yes,
something like that.
yes, yes,
Because
yes.
in other countries they are just providing the dummies, and they are not giving the proper education.
No. It's very important part of education process to meet with real patient, because you can read lecture, you can read book, but when you meet with real person, you will not collect information about one disease. You will
Yeah.
collect information about person with additional disease that can influence to the general disease. We connect with his life that can influence to the development of disease too, and that's why it's very important to work with real patient, and our university provides this.
Okay, and I have one more question that is very important for the Indian student. As per National Medical Commission, that is our Indian government rules and regulation, there is one term regarding the English medium program that Siberian State Medical University is providing, as you told. And a part of that, we have one query from the students, that is Siberian State Medical University or any medical university of Russia is providing the intensive program also in that 6 year.
Yes, of course, for
So
1 year.
yeah, so it will be, everything will be included in that complete course.
Yes.
Okay, and after that they have to give for the accreditation exam.
Yes, of course.
Okay. So have you ever had the experience for the accreditation, as you are doing, you already completed your PhD program. So can you please share about your experience about the accreditation exam to get the license?
So actually it was so long time ago.
Yeah.
At that time it was very stressful for me, for my classmates and other. But now when I come back to this period, I understand that it was so easy. And now this accreditation exam, it's not only for checking the knowledges, it's for understanding medicine more.
Yeah.
Because sometimes I remember some pattern and algorithm of preparing to this accreditation when I work with real patient, because I work and I remember it's from preparing to accreditation, and do like this one.
Okay, so it will be very easy journey for the PG, for the residency program, and for the PhD also, right?
Yeah.
After giving the accreditation exam.
Yes, Russia fulfill now all IMC rules and guidelines.
Yeah. So it means our NMC rules and regulations is getting fulfilled by only the country, that is the Russia. So thank you for joining us, and from Dr. Amit and from my side, we are really thankful to you for giving such a wonderful information to our future doctors, and I hope you will give good knowledge to our students who will be your future students
In November.
in November, and they will face your lecture. And please just pass our students when they will come to you for examination. So thank you everyone. एंड आई होप ये वीडियो आपको बहुत पसंद आया होगा. अगर ये वीडियो आपको पसंद आया तो प्लीज़ इस वीडियो को शेयर करना अपने दोस्तों के साथ. और अगर इस वीडियो से कुछ भी आपको इन्फॉर्मेशन मिली होगी तो सब्सक्राइब करना यूट्यूब चैनल को, ताकि आपको और भी आगे चल के बहुत सारी इन्फॉर्मेशन हम इस चैनल के माध्यम से आपको देंगे. और टिल द नेक्स्ट वीडियो, गुड बाय, टेक केयर, जय हिंद, जय भारत.